Good morning, wherever you are. This is Orion Reed from ConferenceHype. Our segment will focus on development and reliability of a competency assessment tool for magnetic sphincter augmentation of the esophagus as part of a video-based surgical quality assurance program for the Gulf trial. From the 2026 August 3 edition of European Heart Journal. Background: heart failure with preserved ejection fraction is a heterogeneous syndrome encompassing hypertensive left ventricular remodeling with diastolic dysfunction and systemic inflammation-driven endothelial dysfunction, with possible contributions from visceral adipose, tissue-associated metabolic, and pro-inflammatory alterations. Methods: however, conventional key risk factors for HFpF, including advanced age, female sex, obesity, diabetes, and chronic kidney disease, are closely associated with mineralocorticoid receptor overactivation through several underrecognized mechanisms, i.e. results. However, conventional key risk factors for HFpF, including advanced age, female sex, obesity, diabetes, and chronic kidney disease, are closely associated with mineralocorticoid receptor overactivation through several underrecognized mechanisms, i.e. discussion. This paper presents the mechanistic pathways linking MR overactivation to HFpF and highlights the potential benefits of mitigating MR activation for its prevention and treatment, calling for renewed consideration of treatment strategies in clinical practice and trial design. From the 2026 August 1 edition of Annals of Surgery. Background: vascular pancreatic surgery is increasingly performed for locally advanced pancreatic neoplasms. Methods: patients who underwent elective pancreatic resections with mesoportal venous interposition grafts between 2003 and 2022 were identified from the Institutional Pancreatectomy Registry. Results: in this study, 201 patients with venous interposition grafts were included. Discussion: alloplastic venous vascular grafts are safe and readily available tools in pancreatic surgery, especially for long-segmental mesoportal venous reconstructions. From the 2026 August 3 edition of European Heart Journal. Background and AIMS, heart failure with preserved ejection fraction, is increasingly recognized in the general population, but the prevalence among adults with congenital heart disease is not well described. Methods: using the electronic medical files. A retrospective, multicenter cohort study was conducted including 4507 OCT patients with biventricular heart physiology and systemic left ventricle, followed at the ACHD centers in eastern Denmark. Results: among 4507 OCT patients, 86% had a preserved LVEF. Discussion: heart failure with preserved ejection fraction is highly prevalent among ACHD patients, regardless of ACHD severity. From the 2026 August 6 edition of Annals of Surgery. Background: obesity is associated with immune dysfunction that supports lung cancer progression, namely reduced cytotoxic T-cell activity and expansion of suppressor populations. Methods: obese and lean mice were implanted with Lewis lung carcinomas under sedentary conditions or with exercise wheel access. Results: obese mice allowed voluntary exercise displayed less profound enhancement of TREGs and potentially suppressive myeloid cells and fewer CD8 plus T-cell deficits in the tumor and lung. Discussion: exercise may reverse adiposity-associated immune suppression in the lung and tumor microenvironments to complement lung cancer interception and treatment strategies. From the 2026 July 28 edition of Circulation. Background: screening for atrial fibrillation on the basis of AF risk may be more effective. Methods: we developed and validated a random forest prediction model for new AF within 6 months, using age, sex, and 10 comorbidities in EHRs in the United Kingdom, Japan, Israel, Canada, and China. Results: FIND-AF2 was applicable to all EHRs and showed good to excellent prediction performance, United Kingdom. Area under the receiver operating characteristic curve, 0.819, Israel AUROC 0.835, Japan AUROC 0.751, Canada AUROC 0.747. China AUROC 0.753, with OROC 0, 7 in men and women in all cohorts, and improved performance compared with CHA2DS2 VASC and C2HEST. Discussion: the EHR-based machine learning model, FIND-AF2, identifies a high-risk subpopulation for AF diagnosis among patients at elevated risk of stroke and could enable scalable, EHR-driven, risk-guided AF screening. From the 2026 August edition of Advances in Radiation Oncology. Background: adjuvant radiation therapy planning for mucosal head and neck squamous cell carcinoma is challenging due to postoperative anatomic changes, contributing to variability in clinical target volume delineation and risk of geographic miss or unnecessary dose expansion. Methods: patient-specific three-dimensional specimen maps may offer a novel approach to improve the localization of high-risk margins and facilitate multidisciplinary communication. Results: 13 patients were treated by 5 radiation oncologists. Discussion: integration of patient-specific 3D specimen maps into adjuvant radiation therapy planning for head and neck squamous cell carcinoma is feasible and can meaningfully influence target delineation, particularly for boost volumes. From the 2026 August 1 edition of Annals of Surgery. Background: the prognostic implications of the technical aspects of CRLM have not been well characterized. Methods: a prospective database of 1776 patients who underwent complete resection for CRLM at a single institution was studied. Results: margin status was independently associated with an initially isolated liver occurrence hazard ratio for positive 1.199 versus greater or equal to 10 margin, 2.21, 1.42, 1.41, p equals 0.001. Discussion: pathologic margin after resection of CRLM is associated with higher rates of overall recurrence that are less amenable to salvage and not just local failure. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 6 edition of Annals of Surgery. Background: evaluating the impact of cognitive load on surgical performance is crucial for training and patient safety. Methods: 20 novice surgeons performed a suturing task under 3 conditions: self-paced, time-pressured, and time and cognitive stress. Results: subjective cognitive load increased significantly with task complexity, while suturing performance declined. Discussion: the DLPFC supports planning and attention, the frontal PFC multitasking, and PMC SMA motor preparation. From the 2026 August 5 edition of European Heart Journal. Background: cardiac computed tomography plays an established role in the assessment of cardiac patients. Methods: in this document, the aim is to demonstrate and clarify the role of CCT in the clinical management of heart disease. Results: this document will cover the clinical indications, prognostic values, and limitations of CCT in the diagnosis and follow-up of heart disease, including ischemic heart disease, valvular heart disease, cardiomyopathies, cardiac masses, large vessel disease, and adult congenital heart disease. Discussion: therefore, this document outlines the technical principles of CCT and its use in everyday clinical practice for cardiologists who are not experts in CCT. From the 2026 August 7 edition of European Heart Journal. Background and AIMS calcific aortic valve disease lacks effective pharmacotherapy and is tightly linked to aging. Methods: this study combined integrated human aortic valve bulk RNA-seq with single-cell transcriptomics to map NAD+ pathways. Results: in aged human valves, NAMPT-mediated salvage exhibited the steepest suppression within valvular endothelial cells, triggering NAD+ depletion, SIRT1 inactivation, and hypercetylated nuclear factor kappa B, thereby resulting in an ICAM1-rich inflammaging profile. Discussion: calcific aortic valve disease is initiated by endothelial NAD+ insufficiency and magnified by metabolically diverse macrophages. From the 2026 August 3 edition of Circulation, background, extension follow-up trials are essential for understanding the long-term safety and efficacy of cardiovascular interventions. Methods, whereas primary randomized trials primarily capture short-term outcomes, extended observation may reveal delayed benefits or harms that are highly relevant to clinical decision-making. Results, however, methodologic standards for extension trials remain poorly defined, leading to inconsistent design, analysis, and reporting. Discussion, practical considerations, including strategies for participant retention, reconsent, data continuity, and resource allocation, are also discussed. From the 2026 August 3 edition of European Heart Journal, Background and AIMS, this study investigates the clinical course and long-term outcomes of adults with subvalvular aortic stenosis. Methods, adults with SAS, prospectively registered in the Dutch Congenital Core Visscher Registry between 2001 and 2019, were included. Results overall, 312 patients were included with a median follow-up of 16 years. Discussion, survival of adult SAS patients with a history of SAS repair was substantially lower compared to the unoperated group, reflecting a potentially more severe SAS phenotype. From the 2026 August edition of Advances in Radiation Oncology, background, pencil beam scanning proton beam therapy is highly sensitive to anatomic variations, often necessitating adaptive replanning to ensure accurate dose delivery. Methods and materials, we retrospectively analyzed 300 consecutive patients treated with robustly optimized PBS-BBT. Results of 761 QACTs performed, 541 were PQACT, and 220 were TQACT. Discussion, PBS-BBT frequently necessitates ARP. From the 2026 August 6 edition of Annals of Surgery, Background and AIMS, robotic liver transplantation represents the latest evolution in solid organ transplantation. Methods, this retrospective multicenter cohort study included consecutive patients undergoing whole-graft RLT at 2 European centers between February 2024 and October 2025. Results, 45 patients met inclusion criteria. One was excluded due to conversion before robotic docking, yielding a final cohort of 44 patients. Discussion, robotic whole-graft liver transplantation achieved benchmark-level outcomes for major perioperative and early post-transplant parameters. From the 2026 August edition of Advances in Radiation Oncology, Background, there are limited prospective data to guide the management of patients with cutaneous squamous cell carcinoma presenting with locally advanced, unresectable disease. Methods, previously, we conducted a prospective pilot study of chemoradiation for patients with unresectable CSCC. Results, 15 patients were enrolled between May 2019 and June 2021. Discussion, to our knowledge, this is the only prospective series of chemoradiation in combination with checkpoint inhibitor immunotherapy for unresectable CSCC. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 6 edition of Circulation. Background: pediatric heart failure-related cardiogenic shock carries high morbidity and mortality but is understudied. Methods: improving outcomes in pediatric cardiogenic shock hinges on timely diagnosis and appropriate triage, medical management tailored to the cause and phenotype of cardiogenic shock, and optimal timing of escalation to appropriate mechanical circulatory support. Results: this scientific statement provides a diagnostic framework for the bedside clinician, in addition to proposing a pediatric cardiogenic shock definition and severity staging aligned with systems previously validated in other studies. Discussion. Last, it identifies future directions for the field, including educational interventions for the frontline clinicians seeing these patients, studying the role of a multidisciplinary shock team, evaluating the prognostic and clinical relevance of known and novel biomarkers, and leveraging all these to develop clinical decision tools or algorithms to guide nuanced management of these patients. From the 2026 August edition of Advances in Radiation Oncology. Background: failure mode and effects analysis is widely used in radiation oncology to proactively identify and mitigate risks, but it is time-consuming and depends heavily on expert experience. Methods: this study evaluated whether large language models can supplement traditional expert-driven FMEA by identifying novel failure modes within the radiation planning assistant workflow. Results: the 4 LLMs collectively generated 190 candidate failure modes. Discussion: LLMs can broaden risk discovery in FMEA by surfacing contextually relevant and previously unrecognized failure modes. From the 2026 August 1 edition of Annals of Surgery. Background: PDAC response to NAT is measured with biochemical, radiographic, and pathologic parameters, which can often be discordant with each other. Methods: patients with PDAC undergoing resection after NAT at a single institution were retrospectively analyzed. Results: from 2011 to 2022, 225 patients underwent pancreatectomy after NAT. Discussion: CA 19-9 response to NAT alone is not enough to identify long-term post-resection PDAC survivors. From the 2026 August edition of Advances in Radiation Oncology. Background: to develop and validate a protocol-agnostic machine learning platform for knowledge-based planning in external beam radiation therapy. Methods and materials: 5,334 retrospective photon beam treatment plans from 2 institutions were used to develop and internally test general-purpose models for organ at-risk dose-volume histogram prediction. Results: in the plan comparison study, there were no or dose metrics for which PPs were statistically significantly greater than clinical plans. Discussion: predictive planning represents a shift in KBP from protocol-specific models trained with small, uniform datasets to protocol-agnostic, disease site-specific models trained with large, heterogeneous datasets. From the 2026 August 4 edition of Circulation. Background: left ventricular hypertrabulation, formerly termed LV noncompaction, is a heterogeneous myocardial entity linked to adverse cardiovascular outcomes. Methods: clinical data from 1160 patients with DCM evaluated by cardiac magnetic resonance imaging and genetic testing were collected from 22 international centers. Results: LV hypertrabulation was identified in 354 patients by fractal analysis and in 343 according to Peterson criteria, with good concordance. Discussion: although LV hypertrabulation is common in DCM, it is not associated with worse outcomes and should not prompt differential clinical management. From the 2026 July 28 edition of Circulation. Background, data on the prognostic value of incidental coronary artery, calcium from non-gated chest computed tomography scans are limited. Methods, between April 2010 and December 2011, a total of 2601 participants underwent same-day gated and non-gated chest computed tomography scans. Results among the 2472 participants, 53% were female, 38% white, 13% Chinese, 26% black, and 23% Hispanic Latino. Discussion, non-gated CAC predicts cardiovascular events with performance comparable to gated CAC. From the 2026 August 4 edition of Circulation. Background, chronic transplant arteriosclerosis is the primary cause of long-term graft failure. Methods, we performed single-cell RNA sequencing and spatial transcriptomics or integrated transcriptomic data from human chronic allograft vasculopathy specimens and mouse vascular allograft models. Results, we identified a novel pro-inflammatory foam-like macrophage phenotype in allograft arterial adventitia. Discussion, this study has revealed previously uncharacterized foam-like macrophages in transplant arteriosclerosis, with COL1A1 enhanced amino acid metabolism, modulating lipogenesis and foamy macrophage formation. From the 2026 July 28 edition of Circulation. Background, myocardial ischemia-reperfusion injury presents a significant clinical challenge characterized by a complex pathological mechanism. Methods, the ubiquitination levels of proteins in mouse hearts subjected to either sham surgery or IR injury were analyzed using ubiquitinome. Results, ubiquitinome analysis revealed that protein ubiquitination exacerbates endothelial dysfunction after myocardial IR injury. Discussion, our findings demonstrated a previously unidentified crucial role of cardiac ECHRD1 in myocardial IR injury. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. concludes the ConferenceHype Weekend Roundup of the top medical journal articles of the week. Which study could change practice, and which paper should we revisit in greater depth? If we missed an important article, tag on X and join the discussion. Share this roundup with a colleague or your clinical team, add your perspective in the comments, like the video, and subscribe with notifications turned on for next week's journal coverage.